especially our community isn't the Beverly Hills community,
Mm-hmm.
not only financially, but from a look standpoint.
Mm-hmm.
But what I really like seeing is one, obviously from a weight loss standpoint, seeing people get healthier,
Mm-hmm.
lose weight, more active, more confidence. The other thing that happens with that as you lose the weight, especially you lose weight from your face, they call it like O face, Ozempic face. You tend to look older, and if you've done all this work to try to be healthier, you want to look good.
Mm-hmm.
So adding a little bit of filler, a little bit of Botox, but there's a balance of filler done well and looking like Janice from the Muppets. So
That's true. Hi, everybody. I'm Becky Longacre with Health Transformers. I'm your nurse, gone health coach. I own and operate Health Transformers, which is located in Maine. It's an in-person as well as online health coaching service to help you lose weight and heal pain. Today, I'm going to be interviewing Charlie Landry. He's actually in my office building right downstairs. He's an osteopathic doctor. He prescribes Ozempic. He has a MedSpa, and I'd like to talk to him a little bit about his services. Welcome, Charlie.
hi, nice to see you.
Tell me about your experience as a provider. Why did you become a doctor?
I became a doctor for a couple different reasons. One, I mean, the usual, like to help people,
Yeah.
to work. I think as a kid, I was kind of a science geek, so it was the mental challenge of the science classes and the whole bit, and then the whole diagnostician aspect, and you're always thinking, even though certain things seem the same, they're not. You're always having to integrate a lot of stuff. So I think I like that challenge. And then help people, and a good chunk of my family's they either worked in mills or in healthcare, so it's just kind of
Yeah, you fell into it.
Yep.
Yeah. What have you enjoyed and what has been challenging in our current healthcare climate?
How many hours do you have? Yeah, so what do I enjoy? I enjoy working with people in general, people that are good. I mean, there's always people that you're not gonna get along with or just aren't nice people, for whatever reason why they're not nice. But
Yep.
in general, that part's great. To be able to see success. People have come in, crutches, because of pain or whatever, and within a visit or two, they're walking out, they're back to work, they're doing all that. A good friend that's losing weight, it's actually my sister-in-law, her labs are normal.
Yeah.
You know what I mean? When they're looking at, potential liver damage and all kinds of stuff, and you're able to fix that.
Yeah.
That part's great. What's awful, the politics, the insurance industry.
Yep.
The big pharma, big banking, all that stuff, and it's hard to. I'm more and more. I hate sounding like a conspiracy theorist, but every time I turn around, I'm looking at fudge data, massage data, and especially with the internet and the way how fast things go, it's really difficult. And then especially in healthcare, where if you're taking insurance, they say they're not, but insurances and non-medical people are completely, totally 100% dictating care.
100%.
And so that makes it rough. So that's the worst part. And having to deal with that, deal with, other people that, there's providers, they're paid by certain organizations to make certain determinations, and right or wrong, they're gonna go with, unfortunately, many of them, not all of them, many of them will go for who's paying them.
Yeah.
Not necessarily for what the truth is.
Right.
So that is constantly tiring. And then just in like a private business standpoint, people ripping you off, people lying, I mean, that part's hard. So you always got to stick with, there's some days where I just have to look at who did I help today?
Yeah.
You know what I mean? Why am I still doing this?
Right.
You know what I mean? There's many times where you just want to say, the heck with this, I'm out of here.
It's hard. It's hard.
Yeah, but I enjoy the mental challenge. I enjoy the emotional response, and helping people and doing the work.
Yeah. So I personally have gotten a good review from one of Charlie's clients. Actually, I saw her in the building, and she was having neck pain, and Charlie fixed her up just in a couple sessions. So I personally am hearing good things about his services. So you have started a MedSpa service. Can you tell the audience exactly what that is?
Right.
and why you started it.
So originally most of my practice was osteopathic manipulation,
Mhm.
and PRP, platelet-rich plasma, or regenerative medicine. And then, especially from an OMT standpoint, insurance is a nightmare. They're not covering things. They're placing limitations that are against their own rules, and they're just doing whatever they want. And you can't survive.
Mhm.
Right. And then also it's physical. I'm a big dude. I played sports. I went to pro wrestling school. So when I do the manual medicine stuff, I tend to be a little more rough and tumble, try to get in there and really fix things.
Mhm.
And that takes a toll on me. My hands hurt, my shoulders hurt.
Yeah.
Between boxing and bowling, my hands and shoulders are messed up. You know
Yeah.
what I mean?
Yeah.
So I had to look at, I'm pushing 50. I've still got, young children. I still got student loans. And then when I left my previous practice, just before I left, one patient was like, "Why? I see what you're getting paid for doing these injections through insurance. Why are you doing this?"
Mhm.
She's like, "You're better than with a needle than anybody I've ever seen."
Mhm.
She's like, "I paid this guy $2,000 cash in less time than it took you to do all this work, and you got $100."
Yeah.
And so then I started thinking, I'm like, from longevity of career, my
Yeah.
wife's a nurse, she's getting tired of the hospital scene.
Yeah.
And so she became a certified nurse injector.
Mhm.
And we decided it's something we could do together. But we're not the traditional kind of stereotypical med spa.
Mhm.
So a lot of them have a remote physician who's not even in the state, with non-supported guidelines for either with the weight loss medications, or you have people that just don't have any medical training, and they're doing filler and Botox. And even with the best injectors, you can have accidents, things happen.
Mhm.
But it goes way down when you have a provider in house and you have a nurse injector, or you have, you know what I mean, that, or especially a provider in house with a good esthetician or an MA can be great for the injections, but you need someone there. There's times even my wife, who's really intelligent and experienced in medicine, and then someone comes in with something, she's like, "I don't know if I should do this yet."
Mm.
You know what I mean? But I'm right there. She comes to get me.
Yeah.
So we were looking at it something as increasing longevity of career, better financial status, and trying to do it in a way that, especially our community isn't the Beverly Hills community,
Mhm.
not only financially, but from a look standpoint.
Mhm.
But what I really like seeing is, one, obviously from a weight loss standpoint, seeing people get healthier,
Mhm.
lose weight, more active, more confidence. The other thing that happens with that, as you lose the weight, especially you lose weight from your face, they call it like O face, Ozempic face. You tend to look older, and
Mhm.
if you've done all this work to try to be healthier, you want to look good.
Mhm.
So adding a little bit of filler, a little bit of Botox, but there's a balance of filler done well and looking like Janice from the Muppets. So,
That's true.
and we're actually going to a conference next weekend to change, instead of using hyaluronic acid filler like we're doing, and it was the standard, we're moving into PRP filler.
Mhm.
So as the filler one, there's been so far no documented incidents of vascular occlusion and damage and stuff. It can still happen, but there's nothing yet so far. And as it goes away and it fades, it stimulates your body's own collagen formation
Mhm. The PRP.
yes, to
Mhm.
stop with to help with the wrinkles and stuff like that.
Mhm.
So and it dovetails with what I was already doing with the manual medicine and the PRP. And that's why, like, my podcast is Balance, Repair, Renew. It's really integrating, and where what was common was what was doing in the traditional medical world and moving into the MedSpa. And then we started doing the weight loss. I've lost 70 pounds with it.
Mhm.
And I want to lose another 40 to 50.
Yeah.
My life is definitely better and changed. And to see the people that I have coming in, they don't have knee pain anymore, they don't have back pain anymore.
Mhm.
And then they're like, "Oh, I don't hurt anymore. I'm getting a new job, or I'm starting a business." And I'm like, "Well, now I want to look good." So they want their skin tightened. They want, so it just makes sense to have it all in one place, and we're not overboard. Everything we try to do is more subtle and natural looking. And that's the approach that I really like. So a lot of people, they right away, expressionless Botox, or the, filler that you don't look like you. We want you to look like you.
Mhm.
Just you 10 years ago.
That's awesome. So you prescribe Ozempic to help people lose weight. What can you tell me? So you have taken it,
Yep, I'm still
and
at it.
and it's working for you in
Yes.
conjunction with healthy lifestyle.
Yep.
So can you tell me what patients can expect if they go on board, if they
Yeah.
get on board with this?
We would do both semaglutide, which is Ozempic or Wegovy, or tirzepatide, Zepbound or Mounjaro. The different names are, one's approved for diabetes, one is approved for weight loss. They're the same medication. We don't the brand name version isn't available. It's very difficult for people to get, and that's covered by insurance if you have diabetes. But from a weight loss standpoint, it's not covered by most insurances yet. So we use a compounded version of basically the generic name. Same drug, same, well, everything's the same. It's just instead of the multi-dose pen, it's a vial that we have to inject you with. So what people can expect is we give you the choice. Some people know someone that's on one or the other. The studies show Zepbound, tirzepatide may have a little bit more benefit for weight loss because it actually works through tooth pathways. The numbers aren't huge. At the bigger doses, it is a little bit more expensive. So for most people, though, they recognize the name Ozempic, they want to start with that. So we do that. So we do an intake, do a health history, check meds. If you haven't had lab work within a year, we'll order lab work before we start you on anything. Because if you are, let's say it comes in and you didn't know you're diabetic and you actually are diabetic, I'm like, well, then see if you can get it through your insurance.
Right.
But I know a lot of people, they can't get it through their insurance still, even though they qualify. The pharmacy doesn't have it. So they come see me and pay cash until they can get it through their insurance.
Yeah.
That's what we do. And we also price it based on, we're looking more at, it's a long-term thing. A lot of other med spas, I know, they bring you up week after week, and it should be every 3 to 4 weeks before you increase your dose due to side effects. They bring you up every week. Regardless of symptoms, people are throwing up, diarrhea, constipation, having issues, but they still want to keep losing weight. And I'm like, that's not the way to do it.
Right.
And you buy a 3-month package, you lose 20, 30 pounds in 3 months. The minute you get off it, you haven't made the lifestyle changes. Your hormones still haven't calmed down and reset. So, you're going to gain it right back. So we have it set up more for, this is a long-term commitment. When anybody comes in, we give them a list of people we recommend them working with, like you, like Prime 360 next door. So we get the functional medicine, the functional training piece, help with strengthening. We have the mental, emotional piece with you, and I just handle the drug part. You know what I mean? And make sure that's safe for you.
I appreciate that you are looking at their overall health and well-being and not just obsessed with the number of the weight loss. Just because, I mean, that's a good doctor, in my opinion, in terms of, not going up all the time with a dose, irregardless of how they're feeling or how their body is doing.
Or they automatically try to bring you up to the maximum dose because again, most of them, they're not medical. There's a off-site physician that just tells them what to do. May not be able to. So like someone was having couldn't tell if it was side effects or they were just sick. So my wife's like, I don't know. So I go in and I do a quick exam. I'm like, is this maybe, hey, they're not a side effect. They have appendicitis. They gotta go to the ER. You go to most med spas, they can't make that assessment. I can, and so that makes a difference. And if you're losing weight at a lower dose, I want to keep you at the lower dose as long as you're losing weight. And then if you plateau for a couple weeks, then we'll all right, we'll bump it up. Because over time you do develop immunity and a tolerance to the side effects, right? In this case, the positive side effect of decreased appetite. And so I see it as, well, if you've been out for a few months and all of a sudden you're like, yeah, I'm getting the munchies again at night, or, I was able to eat a whole cheeseburger before I could only eat half, well, then we'll bring up your dose a little bit, to help with that. So you're looking at a longer term solution to integrate with everything else you're doing. So most people are overweight, have been overweight not for 2 years, they've been overweight for 30, 40 years. The hormones are messed up, the relationship with food is messed up. people are obese for different reasons, and it's a multifactorial combination of things. It's behavioral, it's genetic, it's emotional. The situations, Uncle Bobby raped Gina at 13 and she overate to shield herself from other men.
Yeah.
I can give you the shot to lose weight, but you're not going to fix
trauma.
You're not going to fix trauma. And so you need to work on that. So and for everybody that's different. Some people it's like, oh, they just blew out their knee and had to have surgery and complications, so they were laid up for 2 years, gained a ton of weight. All right, well, that person's probably going to not have to be on it as long, and not have to integrate as much.
Right.
But so you have to look at everybody that way, and everybody as an individual, not just a paycheck walking in and here's the protocol and you're out the door.
Yeah, 100%. Individualized care. Is there a subgroup of the population you focus on, or do you serve everybody?
Well, I don't know. I mean, I offer everybody. It's I guess a subgroup would be more, you're overweight, but you're not diabetic. You know what I mean? Because you can get your insurance through that. And the hard part where the insurances are starting to cover Ozempic for people overweight, they're only covering it if you've already had a heart attack. I'd rather not have the heart attack.
I know it.
Yeah. So if we're going to save money and keep people working, it should be before.
Yeah.
So that's the group I'm looking for. The people that we really tend to work with and respond well with is obviously the self-motivated. I love the weekend warriors. I love the self-employed people, or the contractors, the people that they work for somebody. They're physical. They just need help because their schedule is crazy. A few that are the newly divorced mom with older kids that's now starting her own business and wants to lose weight and look good, and you know what I mean. So we do everything. I have a lot of former military, active police. So I will offer it to anybody, but the population that obviously is the non-diabetic if we're looking at the weight loss. And then also from a MedSpa standpoint, the people that are looking to be refreshed and look more youthful, but not like if you come in telling me you want to look like Barbie or Kim Kardashian, I am not your provider.
Right.
I mean, I can do it, but I'm like, that's not I want the people that just like, hey, I got to do a bunch of photographs and stuff for my new website, for my new business. I don't want to look like a tired 55-year-old who's raised 3 kids. I'm like, all right, that's the person that, you know what I mean, that we can absolutely love to work with.
If someone is interested in getting services from you, how do they make contact with you?
There's the LandryHealthcare.com website. There's the Twin City Medical Aesthetics website. Both numbers are there. So usually phone is usually the best. So any voicemails get texted to my phone, even if we're closed. So I just flag it and we call you as soon as we get in. That's usually the best way.
I will make sure that I have contact information in the description,
Okay.
so people can make contact with you if they're interested.
Excellent, thank you.
If there is one thing that you could tell a healthcare professional looking to start their own business, what would it be?
Only one thing. There's a lot.
Yeah.
The big thing, the one thing I want to say is good job. You're getting out of the hospital industrialized medicine complex.
Yeah.
You know what I mean? Anybody who it takes serious courage. The system is, in my opinion, designed to crush private practice. I did a trigger point on someone. The insurance fought it. I only billed $170. I'm lucky to get $53. An NP in a hospital is billing $740 for the same trigger point. You know what I mean? That's just awful.
Yeah.
You know what I mean? Or I got a friend of mine who's an OB surgeon, which it's hard for surgery and be on your own. She does a hysterectomy, let's say. Her cut is $250 on a $45,000 procedure. This part's that. So if you can go on your own and make it work and keep the price down and provide good direct care. I like my primary care provider is a direct primary care, and that is excellent. And if you can do that, which makes it hard, unfortunately, it does cause more of the haves and have-nots, right? You have because these people aren't taking insurance. Because I think the only way we can change things is for patients to start fighting back the insurance companies. Because they keep making billions in profits and cutting what they cover, increasing your premiums. Private practices are getting crushed. Hospitals are getting crushed. And yet they're making all the money because they have a lobbyist. And so it makes it hard. So if you're a private practice physician and you're trying to go on your own, kudos. It's work, but it is absolutely worth it. But you have to be diverse too. You have to have multiple streams. From a
Yes,
business standpoint, you have to be able, you can't just say, I'm just going to do this one thing. It ain't going to work.
right.
And everything takes time. It takes about 5 years to grow a practice and get it. And then in this, I opened my practice 3 months later, everything shut down because of COVID. And it took another 2 years of being down and now growing. So now I'm rolling and it's growing every month it's definitely been well worth it. But it was a 5 year fist to your face and just like put your shoulders up and head down and wade in and start swinging.
Right, exactly. Multiple streams of income, very good. Having the courage to believe in yourself, very good. Having a community, so talking with other entrepreneurs, medical entrepreneurs that are gonna bounce ideas off of each other to help you is all very helpful. So we had talked in a previous conversation about how Ozempic is covered by health savings accounts, right?
Right.
So I'm just making that aware, I'm letting the audience know that. So health coaching is covered by most health savings accounts. Ozempic is covered by most health savings accounts or flexible spending accounts or employee wellness programs. So if you're thinking about getting these services, but you don't think that you have the cash, it's possible that you do have the cash in a funded employee and your funded source. So I just want to put that out there.
And also, like some people have said the same thing. What happens with these medications, the GLP-1s, they which is the weight loss meds like Ozempic, they help stop other cravings and you eat less. So we also try to price it in the point that what you're going to save in decreased grocery bills, decrease going out to eat, decrease alcohol consumption. People quit smoking, quit drinking, or significantly cut back. So even if you look at the price per month, you may be spending only $100 or $200 more than you were before. And I know several people, they're spending considerably less just on what they were eating. You know what I mean? The one guy get up in the morning, eat 4 eggs every day, and now he's having one. You know what I mean? That's going to save you. That's $100 a month probably. When you look at other things that they're eating.
But then the added cost of co-payments because you have to have the knee surgery because you have osteoarthritis and your knees, the added weight is adding to the osteoarthritis. So down the road, you're going to save a lot of healthcare costs in co-pays. Also, it's just, you feel a lot better when you lose weight, you can move your body, you have more endurance, less medical complications and things like that.
And then, like some people say, well, I got to be on this medication forever. Some people will. You know what I mean? I pretty much with my life, I'll always have to be on one of these medications to even maintain. Hopefully, be at a lower dose and just keep going. But also, when you think of there's over 200 comorbidities associated with obesity, and just your top ones, arthritis, cardiovascular disease. So, I was on track where my watch was telling me when I was walking my dog that if my VO2 max, my fitness level stayed where it was, I was gonna have a heart attack soon. And I'm like, the cost on that, you know what I mean? So if I figure, yeah, I'm on this medication, but it stops me from being on a cholesterol med, on a blood pressure med, on insulin, to eventually get dialysis, to get a knee replacement, to get, you know what I mean? all the other things that happen as a sequela of just being obese. You have increased risk of depression, increased risk of colon cancer, prostate cancer, breast cancer. All of those are significantly increased just by being overweight.
Yeah.
So the amount of money you save long term by managing your weight, being a healthier weight, and being more active is priceless.
100%. Charlie, Landry, thank you for joining us.
No problem. You're welcome. Thanks for having me.